When you're counting down the last days before delivery, learn how to make the first hours after delivery count. For breastfeeding to become a relaxing and fun part of your future, nursing needs to be comfortable for you and easy for your baby, and you need to make plenty of milk. This doesn't always happen automatically, but by understanding what to do in the first hours, you can get there. Instead of seeing how things go and not realizing this is the best time to prevent problems, know that breastfeeding can be in your hands when you understand 3 key points before delivery. What is a good latch? How can I help my baby if needed? And how can I make more milk sooner? Your baby is already learning to breastfeed. Powerful scents or smells in the warm amniotic fluid surrounding your baby, which are very different in each mother, program the unborn baby to learn mouthing behavior. After birth, the identical scents in your milk stimulate him to search for your breasts. What most people don't understand is that the first few hours after you deliver are super important hours. That in fact you never get back again. So we want to take full advantage of them. So the first thing we'll talk about is attachment. And what that means is how a baby latches onto a breast and how he gets milk out of the breast. So when a baby is latched onto the breast well, the nipple is positioned and protected far back in the roof of his mouth. The reason that's important is because then the massaging action of his jaw and tongue is not on the nipple, but below the nipple, so he's massaging right here. This is how he can effectively get milk out of the breast. If he's not latched on well and the nipple is right by the lips, then he doesn't get milk out of the breast, and it hurts, and it doesn't send a signal to the breast to make more milk unless he effectively gets milk out. After your baby is born, your obstetrician or your midwife will take your baby and place him skin to skin right on your breast to recover, maybe even before the cord is cut. And babies normally take a period of time to recover from the delivery itself and to wake up and explore and find your breast, scoot over to your breast, latch on, hopefully comfortably, and learn how to nurse effectively. Okay. But if he doesn't, I don't want you to worry about that. If he doesn't learn how to nurse effectively in the first hour, you can take advantage of that first hour by making sure your production is protected by getting the milk out of your breast, even offering it to your baby. And you can also use your hands to help a baby learn how to latch onto the breast. Okay. How can I help my baby latch if needed? If he's still struggling after a few hours to latch onto the breast, I want to show you how to position him to make it easier for him to latch onto the breast. Take this arm and run it along his back with a nice tight C at the base of his skull, just like that, so that you're kind of able to direct him on where to go. So we'll start off with nipple to nose, always making sure that when he nurses, his head is tipped up, so his chin is pushing into the breast more than his nose. That way, the nipple goes straight to the top of his mouth, instead of, if we had him too high, the nipple would point down towards his tongue, and that would hurt and make it impossible to get the nipple back there. When you're nursing off of your left breast, you'll use your left hand. And for the same position that you hold a cup, keep your hand just like that. Nice C. Then you turn your hand under and make a C with your breast. Comfortable C, just like that. You'll turn your breast into more of an oval rather than a circle. So an oval will help his mouth. When he opens his mouth wide, he'll be able to latch on right down here so he can massage milk out. Look, all of a sudden we're kind of getting milk. If he was latched on too high up to your nipple, he wouldn't get anything. But if he's right down here, then he can get milk out of your breast. This way, the breast is sort of sandwiched in a way that fits into his mouth well. But if you held your breast in the wrong way, like this, then you could see that to get his lower lip down here would be much harder for him. It would be like trying to put a sandwich in the wrong way. So instead, hold your breast like this, and then he can just tip his head up, open his jaw, and we can get the nipple right back to that protected spot. The next thing you do is you just rub his upper lip. Wait till he has a nice wide mouth. And when he has a nice wide mouth, then you would bring him in swiftly onto the breast. And when he starts nursing and you're sure it's comfortable, remember to keep his chin pushed in more than his nose, and it's perfectly comfortable. Then you relax the C on your breast and carefully bring your hand out and wrap it around him and sit back and enjoy. In any position, you'll want to make sure your nipple is far back and angled towards the top of your baby's mouth. His mouth covers more of the dark area below the nipple than above. With his head tipped up, his chin pushes into the breast, and your baby has long stretches of sucking and swallowing. With a bad latch, the baby's tongue and jaw will rub and hurt the nipple. Use your hands to help your baby get a good latch, with the lower lip far below the base of the nipple. Try different positions to see what's most comfortable, as breastfeeding should not be painful. In this cross-chest hold, run your arm along his back with your hand snugly supporting his head at the base of his skull. Position him nipple to nose. Now wait for wide mouth before bringing him to the breast, chin first. Wait for him to suck before relaxing the hold on your breast, keeping his head tipped up. Remember to wait for a yawning mouth, not a little fish mouth. In a football hold, tuck him far back at your side with your arm along his back, head tipped up, nipple to nose. Support your breast with fingers parallel to his lips. Rub his upper lip and wait for that gaping mouth before bringing him in, chin first. Listen for swallows. Man alive. Babies who have difficulty with latch early on become champions over time when milk increases around the 3rd to 4th day and flows easily, and with the experience of spending lots of time close to your breast. Ask for help and put a lot of effort into building your production without relying only on your baby. How can I make more milk sooner? Let's go back to the first hour. And let's say that this baby, for whatever reason, maybe he was separated from you, or maybe he was just too sleepy. For whatever reason, he was not able to latch onto your breast. The one thing we need to remember is that the first hour is super important as far as establishing a really robust milk production, because this is the hour to signal your breast to make plenty of milk. So if your baby is on the breast, but you're not even sure if he's nursing very well, you can use your hands to get milk out of your breast.
Okay.
So let's learn how to do that.
Okay.
Let's go back to make a C, just like that, with your hand, just the way you hold a cup. Take the cup out, and now you can just put your hand any way it feels comfortable. And what you're going to do is you're going to just push back towards your rib cage, and then you're going to bring your finger and your pointing finger together, just like that, and then relax. So you can push back, compress, and relax. Push back, compress, and relax. And you're very lucky because you get so much milk out. Some mothers don't get a lot of milk out, and that's okay. This action is really what stimulates the production. So that's just fine. Now let's say that you wanted to save some of this for your baby. What we can do, and your partner can help you, is take a nice clean spoon and push back and then relax. Push back and relax. Push back and relax. And then we have a nice spoonful of dessert that we can give your little baby. Then what you can do is you can swaddle your baby a little bit so his arms don't hit the spoon, and bring this in and just let it sit on his lower lip. And what he'll start doing, if you just give him just a drip, is he'll start tasting it, and with it, just like a kitty cat, he'll start licking it and swallowing it. The hormones of delivery generally make hand expression in the first hour easier than on the next day. Making plenty of milk doesn't happen automatically. The powerful and critical signal to your breast to make more milk sooner is milk removal in the first hour, and then every 2 to 3 hours over the next several days. So never worry about collecting every drop. You'll just make more. Feed your baby whenever he appears ready, way before he cries. He'll be less likely to get too little milk, or to lose too much weight, or to become too jaundiced. If you nurse very frequently and offer dessert from a spoon, in the first 3 days, you'll never overfeed first milk. You'll know when he's full. Days before your due date, practice the technique of hand expression. Now, what we've talked about is how you can help your baby latch on comfortably and effectively, and also what to do if it doesn't work perfectly in the first hour. So now you really understand how important it is to use your hands. you.